What is diastasis recti? How do you know if you have it, and how can you tell if it's getting better? Diastasis recti is a separating of the rectus abdominis muscle. Sometimes it can be just a thinning of this fascial tissue in the middle, but it can feel literally like it's tearing apart when women feel it, and it can freak you out a little bit because it's kind of a crazy thing to feel. So let's check for diastasis recti and see if you have it. All right, so if you think you might have it, you want to always avoid forward flexion abdominal activities until it heals, which means getting in and out of bed. All right, I know you immediately thought sit-ups and crunches when I said forward flexion, and you're right. Pilates roll-ups, hundreds, things like that, anything where you're putting a forward flexion force on the abdominal wall, that can cause it to split more and can prevent healing. So we want to give our body every opportunity to heal and not stop it and hinder it in that process. So to lie on your side, lie down, lie on your side, okay, and then roll over on your back. Fantastic. Now I'm going to have you go ahead and pick your shirt up. That way we can get a great view looking at that rectus abdominis muscle. Now I am almost in my third trimester, so now is not the best time for me to check for this because I have something in the way. But I have too many women asking me how to check for diastasis recti, and I think it's an important thing to do before you start this program, and then check it frequently through the program. That way you can tell if you're making progress. All right, so find your belly button, and we're going to check above and below the belly button area. All right, so let's go ahead and put your fingers above. Now we're checking for finger width. Technically, 2 finger widths, more than 2 finger widths, is considered diastasis recti, okay, where that rectus abdominis muscle is splitting. Now, I really have high standards. I like to have 1, okay? So, but anything 2 and under is considered acceptable and normal. So basically, you're going to place your fingers in that middle trough, and what you're feeling for is the rectus abdominis muscle on either side to contract when you lift your head. Right now, I have currently 1 finger width in here. Right, so I can feel the right side, I can feel the left side, and I can feel in the middle between those 2 sides. All right, so feel there, start there, a couple inches above your belly button, and then move down close to your belly button, right above it, and pick up your head again and feel there. Now, because of my spreading belly with being pregnant, I can feel a finger width plus maybe a tiny little bit right here. Okay, and then I'm going to check below my belly button. Below my belly button, same thing, I'm at 1 finger width. Okay, and then I'm going to check a couple inches below that, and that is a little less than a finger width. Now, you might be saying, Sarah, I don't feel anything. Everything is squishy. Okay, so if that's the case, if you can't feel anything, just pick your head up a little higher, okay? It might be that you just need a little bit extra to encourage that rectus muscle to contract. All right, so you're lifting and you're feeling for either side of the muscle. And so it's almost like you have a little ditch in the middle, all right? And that's what that diastasis recti does. So you can either feel like a squishy ditch in the middle, or you can see a hernia starting to form on your linea alba, or tissues will bulge out depending on how you're contracting your muscles. All right, so what we're feeling for is we're feeling for that separation and the distance of that separation. When you lift your head, you feel the rectus muscle contract, and you feel for either side of that rectus muscle, and then that will tell you if you have diastasis recti and how bad it is. All right, this is a great way for you to measure it, and then measure it frequently. So just pretend that you're on a diet, all right, and you measure yourself on the scale once a week to see how you're doing on your diet, right? So same thing with this rectus. As you go through the program, make sure you measure frequently so you can see the results of the program. Because you need to measure different places on your belly, because there are different parts of your body that contribute to diastasis recti. From rib cage closure, and as you guys can see, I'm managing to keep my rib cage fairly closed through pregnancy, but don't worry, I'm not squishing the baby, so it has room to go in the back, because when you close the front, you open the back, all right? So you get expansion, it just depends on where your rib cage is sitting. This can help tremendously with back pain. All right, so if your rib cage is flared, that can pull on that diastasis and that can cause it to open. All right, same thing if you're constantly hanging into your belly in your standing posture, and I'll go over that in a second. Constantly hanging into that belly, that can cause more of the belly button to split. If your pelvis is not aligned correctly, you're constantly clenching your glutes or hanging into an anterior tilt, that can cause the bottom diastasis around your belly button to open even more. Okay, so looking at those different postural controls for how your body holds itself together is extremely important. And this is not something that we can fix by drawing in your belly button, because drawing in your belly button prevents your ribs from coming down. All right, so take my belly button challenge if you haven't yet to find out what I mean by pulling in your belly button is not the best way to fix your diastasis recti. As you go through this program, you're going to notice that we tackle the diastasis from several different angles. Because diastasis recti, where your rectus abdominal muscle starts to separate, has a lot more to do with how you are loading your body, how you hold yourself, how your rib cage is moving, how your diaphragm is performing, how your pelvis is angled, than it does with just trying to draw in your belly button. Okay, if you don't believe me, take my belly button challenge. So drawing in your belly button is not the best solution for closing your diastasis recti. It can make you feel a little better, like you're doing something, kind of like holding Kegels to fix your pelvic floor. But as we all know, Kegels are not the best treatment for the pelvic floor, just like drawing in your belly button is not the best treatment for diastasis. I am working very hard through this pregnancy to prevent diastasis recti from happening to my belly. All right, I don't want it to happen. So as you can see, I do not stand like a normal pregnant patient. All right, I am standing tall and straight. Not military tall, relaxed tall, but a tall that comes from keeping a little bit of activation through my transverse abdominals. And I am not doing this through drawing in my belly button. Obviously, it's really hard to draw in a belly button when you're pregnant. I am doing this through proper posture. So with the right exercises, you can gain better posture, which can then help to support your diastasis all day long and help it to heal. So let's fix your body, head to feet, once and for all, so that you're not dealing with things like diastasis, pelvic floor issues, back pain, shoulder pain, neck tightness. It all has to do with how the kinetic chain, how your body connects each part to one another. All right, the hip bone's connected to the leg bone. You remember that age-old song. Well, it is so true. And it is so true for when we try to fix things in life now and we put little band-aids on them. Oh, just do this one thing, or oh, just do Kegels, or oh, just pull in your belly button. That doesn't cut it for truly fixing our bodies and helping us feel great, having loose necks that feel awesome, having no back pain, having diastasis that stays closed and closes quickly in that postpartum period. All right, so let's fix you, but let's fix all of you and get you working together.